Hello guys, so now let us start regarding the neuroanatomy. Let us start with the neural tube defects. So all of you know that this is your ectoderm, this is your mesoderm and this is your endoderm, right? Now in the center, this green color part, whatever is there, these are the precursors of your neural tube. What are they? They are called as the precursors of your neural tube. On either side of these precursors, you have got precursors of neural crest cells. So what is going to happen is that the neural crest cells on both the sides, they come each other and pull this entire structure together. So overall, that would lead to the formation of the neural tube in the center. So when is the neural tube formed? The neural tube formed on the day 20. Okay. Next important thing is that within this neural tube, you have got amniotic fluid, right? So amniotic fluid is considered as the first cerebrospinal fluid. Okay. After delivery, the cerebrospinal fluid is formed by choroid plexus. But before the delivery in the womb, what is the cerebrospinal fluid? That is the amniotic fluid, is the first cerebrospinal fluid. Now, normally you need to know that this neural tube will lead to the formation. What is the neural tube? See, this neural tube, this is neural tube. That would lead to the formation of central nervous system. Okay, whereas neural crest cells, I mean the cells that are located on the sides are called as neural crest cells. They lead to the formation of peripheral nervous system. Okay, neural tube will lead to the formation of central nervous system, whereas neural crest cells will lead to the formation of peripheral nervous system. Next important thing is that within this neural tube, there are two important openings. This is called anterior neuropore. This is called posterior neuropore. If normally anterior neuropore should close by day 25. If it does not close, then this anterior part, I mean the head and all, it is not formed. That condition you call it as anencephaly. Just look at the picture over here. All of you just look at the picture over here. This is the anencephaly where the half part of the head, half part of the brain is absent. Why? Because anencephaly is because of the anterior neuropore did not close on day 25. What if the posterior neuropore doesn't close on day 28? Normally it should close on day 28. If it does not close on day 28, this would lead to spina bifida. Okay, what is this? That would lead to spina bifida. So these are called as a neural tube defects, and there are many more neural tube defects to discuss. I will discuss one by one. But remember one thing, that these neural tube defects, right? So what is this picture? This was a picture which I just shown you. This is a picture of anencephaly. This is a picture of what? Anencephaly, where the anterior neuropore didn't close by day 25. Okay, that is anencephaly. And what did I tell you? If the posterior neuropore does not close by day 28, that would lead to spina bifida. Okay. Now, if you look at spina bifida, there are many different types of spina bifida. Many different types. Okay. So, for example, if you look at spina bifida, what are the different types of spina bifida? You know, the first important thing is spina bifida occulta. One is spina bifida occulta. Now, next important thing is spina bifida with meningocele. Spina bifida with meningocele. Third important thing is spina bifida with meningomyelocele or mylomeningocele. Okay, meningomyelocele or mylomeningocele. And fourth important thing is rachis kisses. Okay, so these are the four important types of spina bifida. Okay, now very important thing is that what is spina bifida occulta? You see a tuft of hair on the back here. This is called as spina bifida occulta. Spina bifida occulta. Okay, now what do you mean by this rachis kisses? What do you mean by this rachis kisses is that normally if you see, the vertebra has to close like this. The dorsal arches of the vertebra has to close and form a spinous process. All of you know. For example, if the dorsal arches are not closed, what will happen? The spinal cord here, the meninges here, the CSF, everything will be herniating outside. So in the patient, what you will see? In the patient, you would see open vertebra. Second important thing, you would see open spinal cord, not only open vertebra, you will also see open spinal cord, and also you would see leakage of CSF, three important things: open vertebra, open spinal cord, and leakage of CSF. If you see these three important things, that is nothing but your rachis kisses. Very, very important. This was previously asked also. This is rachis kisses. Okay. So, next important thing. What is the next important thing over here? See, this is the normal patient. In this normal patient, what has happened? You just see a tuft of hair on the back. This is called as spina bifida occulta. Now, look at the next picture. In the next picture, what is happening? This red color thing is the spinal cord in the center, but surrounding the spinal cord, this green color one is called as, what is this? This is your meninges. The meninges is herniating outside, you see, and there is also CSF within this. Now tell me, this is spina bifida with only meninges or meninges and spinal cord? Only meninges, right? So this is called as spina bifida with meningocele only. This is meningocele because only meninges are present. Look at the next one. Not only meninges, even the spinal cord is also present. So this is spina bifida with meningomyelocele or mylomeningocele. Meningomyelocele or mylomeningocele. Okay, this is one of the important things. Now look at the picture here. Now identify and tell me which is meningocele, which is mylomeningocele. So look at this particular picture. If there is only meninges that is herniating outside, you would see that the cyst is glowing and the cyst is shiny. So you see a shiny cyst here. You also see a shiny cyst here. So this is nothing but spina bifida with meningocele. Okay, spina bifida with meningocele. Now, here also there is a cyst, but I don't find any kind of shininess over here. So this is spina bifida with mylomeningocele. Very, very important. Okay, very important. The next important point I want to discuss over here are the ventricles of your brain. Ventricles of your brain. Now let us see what are the different kind of ventricles you have got. Now in this particular picture, nothing to worry. In this particular picture, what are the important things you can see? First of all, let us note down all the important structures over here. Now what is this outermost part? This outermost part is called as your dura mater. Just beneath the dura mater, you will have arachnoid matter. See, this part is called as arachnoid matter. This pink color one is called as your arachnoid matter. Inner to this arachnoid matter, you have got something called as pia mater. Okay, what are the three important things? You have got the dura mater outside, you have got the arachnoid matter in between, and you have got the pia mater here. Okay, next important thing. Now, if you see, this arachnoid matter is showing some finger-like granulations inside, right? First of all, what is this blue color pool? Tell me, what is this blue color pool with the dots inside? This is called as your dural venous sinus. What is this? This is your dural venous sinus. Now, into this dural venous sinus, the subarachnoid membrane is putting some finger-like granulations. These finger-like granulations are called as subarachnoid granulations. What are they? Subarachnoid granulations. These are called as subarachnoid granulations. Okay. Next important thing, if you go deeper inside, you see this is called as your ventricle, first ventricle. This is called as your second ventricle. Okay. Now both of these ventricles, the first and second, are communicating with the third ventricle. Third is communicating with the fourth ventricle. Right? So the first two ventricles are communicating with the third ventricle with the help of a narrow small opening, and this opening which I have drawn over here is nothing but called as foramen of Monro. What is this? This is called as foramen of Monro. Down here, third ventricle is communicating with the fourth ventricle with the help of aqueduct of Sylvius. Okay, and finally fourth ventricle is also having some openings here, right? What are these openings? These openings are called as foramen of Lashka. There are also other openings called as foramen of Magendie. You cannot see it here, but you see this pink color opening over here. This is called as foramen of Magendie, but just remember foramen of Luschka. Next important thing is that within the third ventricle also, okay, within the third ventricle also, you have got granulations like this. Within the fourth ventricle also, you have got some finger-like projections like this. What are these finger-like projections? These finger-like projections are nothing but called as your choroid plexus. You see here also in the first two ventricles, you have got these finger-like projections. These are nothing but called as your choroid plexus. And remember one thing, choroid plexus is the one which releases the CSF. You see, choroid plexus is the one which is releasing the CSF. Okay. Next, lining your ventricles, there are some epithelial cells. These epithelial cells are called as ependymal cells. These epithelial cells are called as ependymal cells. Okay. So, how does the CSF flow? We shall discuss now. The first important thing is that CSF, right, is initiated from the choroid plexus. I told you choroid plexus will release CSF. Now, once the CSF is released, this CSF is directly released into your two lateral ventricles. Now, from the lateral ventricles, it enters into the third ventricle. From the third, it enters into the fourth ventricle. Now, from there, through foramen of Luschka and Magendie, it enters into the subarachnoid space. From the subarachnoid space, through subarachnoid granulations, dural venous sinus and superior sagittal sinus. Let us look it in the form of a picture. Now look here, choroid plexus is synthesized here. From here the choroid plexus enters, from the choroid plexus the CSF is entering into the ventricles here. Now this CSF will go down all the way passing the foramen of Monro and enters into a third ventricle. Even in the third ventricle also additional amount of CSF is released through this choroid plexus. Now from the third ventricle the CSF goes to the fourth. From the fourth ventricle with the help of foramen of Luschka, it enters into a subarachnoid space. Now in the subarachnoid space, the CSF is moving upward, right? You see, the CSF is moving upward, 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 and finally, the subarachnoid matter is having granulations called as subarachnoid granulations, I told you. With the help of the subarachnoid granulations, the CSF enters into dural venous sinus. Now from the dural venous sinus, later on, the CSF will enter into superior sagittal sinus. Superior sagittal sinus. This is the way of CSF that is floating out. Now, what is the clinical importance here? Clinical importance is there is a condition by name hydrocephalus. Hydrocephalus in the sense excess amount of CSF, accumulation of excess CSF in the ventricles is called hydrocephalus. Now, under what conditions there will be excess level of CSF? There are two most important things. What are those two most important things are? For example, let us say that there is some kind of obstruction here. If there is an obstruction at this point, the CSF in the first and second ventricle, do you think it will flow into the third ventricle? No. So can I tell that this is an obstructive hydrocephalus? Yes or no? This is obstructive hydrocephalus. Next important thing is that, for example, if this choroid plexus starts releasing excess amount of CSF, even in that case also within the ventricles, the CSF will be more. Yes or no? Now, that kind of CSF is called as excess release of CSF. Basically, there are two different types of hydrocephalus, communicating, non-communicating. Now, if I develop a obstruction here, now tell me, the first two compartments, can it communicate with the third compartment? No. So that is why this is called as non-communicating CSF, a non-communicating hydrocephalus. Next important hydrocephalus is excess release like this. When there is excess release, what is happening? There is no obstruction, just there is excess release from the choroid plexus. So in that way also there is excess amount of CSF. This is called as communicating hydrocephalus. Okay. So there are two different types of hydrocephalus over here. One is called as non-communicating hydrocephalus. Another one is called as communicating hydrocephalus. Why there it is called as non-communicating? Because of obstruction to the ventricles. Because of what? Obstruction to ventricles. Okay, it is because of obstruction to ventricles that one ventricle is not communicating with the other ventricle, and mostly this problem is congenital. Keep that thing in mind, this problem is mostly congenital. Now, when it comes to another problem, that is communicating, right? Here what is happening? Here there is excess amount of CSF that is produced. Excess amount of CSF that is produced. And this condition is acquired condition. This condition is acquired condition. So, these are the basic two things which you want to remember. Now, look at this. This is a normal ventricle. You see, these are the normal ventricles with CSF inside. Now, once if there is excess CSF, what will happen? The ventricles will enlarge obviously. Look at the next two pictures. You see, excess CSF is causing enlargement of your ventricles. Enlargement of your ventricles, right? So, this is called as your hydrocephalus. Okay, right. Coming on to the next most important thing over here. Coming on to the next most important thing over here that we have to discuss after discussing the three important layers like dura mater, arachnoid matter and pia mater, we have to also discuss their clinical importance. This is very, very important. So, this outermost layer is called as your skull cap. Okay. After that, the next blue color layer which you can see over here is called as your dura mater. Okay. Just beneath that you have got arachnoid and pia. You know this. Now, there are different kinds of hematoma which you need to know, right? What are the different kinds of hematoma? One is called as extradural hematoma. Other one is called as subdural hematoma, right? Another one is called as subarachnoid hematoma. So, what are these important things? Extradural in the sense outside the dura mater. Outside the dura mater in the sense this is the space, right? So, in the extradural space, what do you have? You have got middle meningeal artery. Now, when this middle meningeal artery, see, this is the middle meningeal artery here. See, this is the middle meningeal artery here, MMA. If this middle meningeal artery is ruptured, that would lead to a hematoma called extradural hematoma, where patient will have lucid interval. For example, let us say there is a rupture of middle meningeal artery in my body. Now, I will go unconscious for 10 to 15 minutes. Again, I'll get up. I'll do my normal work. Again, I'll go unconscious. Again, I'll get up. You see, this is called as lucid interval. Okay, that where you see in case of extradural hematoma. Now, just beneath the dura mater, anything below is called sub. Below the dura mater and above the arachnoid mater, this space which you can see is called as subdural space. Within this subdural space, you have got veins called as bridging veins, right? Now, the hematoma which will develop in the subdural space is because of the rupture of this bridging veins, and this hematoma is called subdural hematoma. Okay. Now, when I tell about the bridging veins, what do you need to know? That mostly in elderly people who are on anticoagulants like varafin, in these patients, when they tend to fall, when they fall basically, in these patients, you will have rupture of these bridging veins leading to subdural hematoma. And lastly, one of the most worst type of hematoma is the subarachnoid hematoma. Subarachnoid in the sense below the subarachnoid space, below the arachnoid membrane. Now, in the subarachnoid space, what do you have? You have got all these dotted lines which have drawn, which is nothing but your CSF. Floating within the CSF, what do you have? You floating within the subarachnoid space, what do you have? You repeat. Within the subarachnoid space, what do you have? You have got CSF. Floating within the CSF, what do you have? You have got this particular artery called as your circle of Willis. You remember the entire circle of Willis which we discussed? So, this entire circle of Willis is here. Now, within this subarachnoid space, what do you have? You have got CSF. Within the CSF, what do you have? You have got the circle of Willis, right? Now, what can happen is that this circle of Willis can rupture. If there is rupture of circle of Willis, what will happen? If there is rupture of circle of Willis, that would lead to the leakage of blood within the CSF. Patient will complain, the doctor, I have a very severe headache, like the headache of a thunderclap, okay? Or he will also tell that this is the worst headache of his life, right? So, that kind of headache you see in case of what? You see in case of this particular subarachnoid hemorrhage. And what are the risk factors? Turner's syndrome, Ehlers-Danlos syndrome, as well as the hypertension. These are the most important risk factors. Next important thing which we shall be discussing is what are the structures that are present on the base of the brain, right? So, these are the structures which you can see in the base of the brain. What are these structures, guys, here? So, the first important structure which you can come across the base of the brain is this particular one, that is called as your olfactory bulb. After attached to the olfactory bulb, you have got something called as olfactory tract. Okay, attached to the olfactory tract down here, just near to the olfactory tract, you have got something called as optic chiasma, right? Where both the optic nerves they cross each other. So this entire thing is not called optic chiasma. This point is called as optic chiasma. Posterior to this optic chiasma, you have got what? Mammillary bodies, right? And here you have got lateral geniculate and here you have got medial geniculate body. Now, why am I telling you these things is that you have to locate these things in a real cadaver, right? Now, let us look at the structures and let us locate these structures over here. Now, what are the important structures? You can see some small rounded structures on both the sides over here. These rounded structures on both the sides are nothing but called as your olfactory bulb. This is called as your olfactory bulb. And hanging down from olfactory bulb, you see this part, this is called as olfactory tract. This is your olfactory tract. Okay. And what is this point over here? This is called as your optic chiasma. This is called as your optic chiasma in the center. Just behind the optic chiasma, you see two bodies over here, right? You see two important bodies over here. These two bodies here are called as what? These are called as mammillary bodies. These are called as mammillary bodies. Okay. Next, down here, these two structures over here is called as your midbrain. What is this? This is called as your midbrain. And if you remember, I told you both the vertebral arteries join together to form basilar artery. You see, this is your right vertebral artery. This is your left vertebral artery. And both the vertebral arteries join together to form this artery in the center called as basilar artery. Basilar artery. Okay, so these are some of the important things which you need to know. These are some of the important things which you need to know. Now, the second important thing adding upon this itself I want to tell you here is that, guys, that let me highlight this part, right? Now, the part which I am highlighting, I hope you can figure it out, right? So, this particular part which I am highlighting here, this part entirely is supplied by anterior cerebral artery. Okay, it is supplied by anterior cerebral artery. Next important thing is that you see this particular part over here. This part over here is supplied by middle cerebral artery. And finally, this part on the back, it is supplied by the posterior cerebral artery. So this is, I'm not being so specific here. I just want you to know which area is supplied by which artery here. Okay. So anteriorly, medially, we have got anterior cerebral artery. Lateral to that, we have got the middle cerebral artery, and down we have got the posterior cerebral artery. Okay. Right. Now, this is one of the very important diagram which you have to know, guys. Now, as this is a quick revision program, so let me just explain you what are the structures which are present over here. Okay. Now, if you look at this particular thing, this is your cerebral cortex. This is the cerebral cortex which are looking from the side. Now, this is the lateral surface of your cerebral cortex. Now, on the side of your cerebral cortex, here there are different lobes, right? Now, what are the different lobes over here? This particular lobe over here is called as a frontal lobe, okay? This particular lobe over here is called as a parietal, temporal and occipital. Now, between the frontal and the parietal lobe, the sulcus which you can see in the center is called as your central sulcus. Between the parietal and the occipital lobe, the sulcus which you can see over here is called parieto-occipital sulcus or simply calcarine sulcus. And down here you have got the temporal bone. Okay. Now, next important thing is that just before the occipital, this is your occipital lobe. Just before the occipital lobe, you have got a notch like this. This is called as pre-occipital notch. What is this? This is called as pre-occipital notch. Now, this is the basic information which you have to know. After this, let us go in little bit detail of the structures which we will discuss now. Now, this is another important picture which you have to keep in your mind, right? We already discussed this is the frontal lobe, this is the temporal lobe, this is the parietal lobe, and this is your occipital lobe, right? So, there are many anatomical structures here, but one by one I am telling you, just remember that way, okay? First important thing is we have to discuss about the central sulcus. See, this line in the center is called as central sulcus, okay? This is very, very important. Anything in front of the central sulcus is called as precentral sulcus. See, in front you have got this red color line. this is called as your precentral sulcus. Anything behind, what do you call it as postcentral sulcus? See, here you have got a line over here, this is called as postcentral sulcus. You have got a line over here, this is called as postcentral sulcus. Okay. Now, between the two sulci, whatever we have is called as gyrus. Okay. So, in front of the central sulcus, the gyrus which we have over here is called as a precentral gyrus. And behind the central sulcus, the gyrus which we have over here is called as a postcentral gyrus. One is called as a precentral gyrus, another one is called as a postcentral gyrus. So, I think till this part you are perfectly clear. Okay. Now, leave this part. Let us enter into the frontal lobe. In the frontal lobe, there are two sulcus first. See, this is one sulcus, this is one sulcus. One sulcus is on the top, you call it as a superior frontal sulcus. Just beneath that another sulcus, you call it as an inferior frontal sulcus. Okay. These two sulci are dividing the frontal lobe into three gyri. This is called superior frontal gyrus, middle frontal gyrus, inferior frontal gyrus. Okay. Now let us leave about the frontal lobe. Let us go to the temporal lobe. In the temporal lobe also, same like frontal lobe, you have got two important sulci. This is called as superior temporal sulcus, this is called as inferior temporal sulcus. And what are the gyri here? Superior temporal gyrus, middle temporal gyrus and inferior temporal gyrus. Okay. Next important thing, if you go to the parietal lobe, right? So, parietal lobe are also having some important things. So, this particular sulcus which you can see in the parietal lobe is called as intraparietal sulcus, because there is only one sulcus, so intraparietal sulcus. Above that is called superior parietal gyrus, below that is called inferior parietal gyrus. Okay. Now the difficult part is the occipital part. What did I tell you? Separating the parietal lobe and the occipital lobe, you have got a gyrus over here, right? This is called as parieto-occipital gyrus or calcarine, parieto-occipital sulcus or calcarine sulcus, right? Now, if you look at the occipital lobe, here backside you have got a sulcus which is transverse, a sulcus which is transverse. This is called as transverse occipital sulcus. Next, a sulcus which is in the form of a moon shaped. This is called as lunate sulcus. If this is a moon shaped, in the front of the moon shape, this is called as one pole, this is the other pole, upper pole, and this is called as a lower pole. Now just zoom in here. This is called as a lunate sulcus. Above that you have got the upper polar sulcus, below that you have got the lower polar sulcus. And connecting all of them, you have got the calcarine sulcus on the back. Okay, so this is all about the occipital lobe. Clear? Now, one of the most important thing here is that we have to discuss about the angulated gyri. That is very, very important. Now, if you look at the central sulcus, surrounding this central sulcus, enveloping this central sulcus, you see an arch-shaped gyrus. That is called as arched gyrus. If I ask you where is arched gyrus present, what you will tell? That is surrounding your central sulcus. Now, if you look here, this particular sulcus which I have drawn in the center, this is called as the lateral sulcus or Sylvian fissure. Now here you can see a sulcus that is present laterally. This sulcus which is present laterally is called as a lateral sulcus. What is this? It is called as a lateral sulcus. So this sulcus which is present laterally is called as a lateral sulcus. Okay. Now guys, let us discuss about this lateral sulcus later on, right? But before discussing that lateral sulcus, let me tell you one thing. See, exactly here near the lateral sulcus, you have got a gyrus over here. This is called as supramarginal gyrus. In the same way, you see this superior temporal gyrus, the end of the superior temporal gyrus the end of the superior temporal sulcus, also you have got a gyrus on the back. This is called as angular gyrus. Next, if you look at inferior temporal gyrus, on the back you have got another gyrus over here. This is called as posterior parietal or temporo-occipital gyrus. Okay. So, behind the lateral sulcus, you have got a gyrus called as supramarginal gyrus. Behind the superior temporal sulcus, you have got a gyrus called as angular gyrus. Behind the inferior temporal sulcus, you have got a gyrus called as posterior parietal gyrus. So till here I want you to remember. So we have discussed some of the very important things here, right? We discussed central sulcus, precentral, postcentral, precentral gyrus, postcentral gyrus. Surrounding central sulcus, the gyrus is arched gyrus. Surrounding this lateral sulcus, the gyrus is supramarginal. Surrounding the superior temporal sulcus, you have got is the angular. Surrounding the inferior temporal sulcus is a posterior parietal. This is the thing which I want you to remember. Okay. Now let us discuss in detail about this lateral sulcus. Just let us look at this particular picture where you will understand about the lateral sulcus in detail. Now, see, this sulcus is your lateral sulcus. Okay. Now, this part, this small part which you can see is called as the stem of the lateral sulcus. This stem of the lateral sulcus will divide this entire lateral sulcus into different rami. See, this ramus which is going back like this, right? This is called as a posterior ramus. But yeah, actually you call it as a sylvian fissure or lateral sulcus. But when it comes to the ramus, you call this as a posterior ramus, which is around 7 centimeters. Next, you have got anterior ramus. See, this is posterior ramus and this is anterior ramus. Anterior ramus, again there are two important things. One is anterior horizontal ramus, anterior ascending ramus. Okay, actually it is like this. This is the exact representation. So you see this is the posterior ramus which is going on to the back. These two are anterior. One anterior is ascending up, anterior ascending ramus. One anterior is horizontal. This is called as anterior horizontal ramus. Ascending ramus is 2.5 centimeters. This is also 2.5 centimeters. Okay. So all of them together you call it as what? Lateral sulcus, or you call it as a sylvian fissure. Very, very important. Okay. So here you can find this sylvian fissure here, right? So this sylvian fissure is having the horizontal and it is having an ascending sulcus. Okay. Right. So let us come back to the original picture over here. Now in this original picture, what I was telling you, that this entire thing is called as your lateral sulcus or sylvian fissure, having two rami. This one is called as a posterior ramus and this is called as an anterior. Anterior mein do, anterior ascending, anterior horizontal. Now these structures are providing a home for three important gyri. What are these three important gyri? One with the yellow one is called as pars orbicularis. Next one is called as pars triangularis. And third one is called as pars opercularis. All these three, pars orbicularis, triangularis, opercularis. See here, this is pars orbicularis, right? Next one is called as pars triangularis, this is called as pars opercularis. Now all these three gyri together, you call it as opercula. The other name for this opercula is the Broca's area, which is a motor speech area. All of you know now where is your Broca's area located, right? So orbitalis, triangularis and opercularis, three of them together you called as opercula, which is also called as your Broca's area. Right, now you might be really getting afraid by looking at this picture, but this is actually one of the very simple picture which you need to know. Right now I am trying to discuss what are the walls of the third ventricle. Okay, so let us discuss the walls of the third ventricle. So here you have got the third ventricle in the center. Let us step by step discuss the walls of the third ventricle. Okay, now I want you to practice this picture. Now what is this picture is that, if you are looking at the cerebral hemisphere, for example, this is the cerebral hemisphere. This is the right cerebral hemisphere, left cerebral hemisphere. Now, this is the supralateral surface and this is the medial surface. What I am doing is that I am separating the two cerebral hemispheres and I am showing you the medial surface of the cerebral hemisphere. So, this is the medial surface. On the medial surface, you have got this C-shaped structure like this. This particular C-shaped structure which you can see here, this is nothing but called as your corpus callosum. Okay. Now this particular corpus callosum is having three important parts. What are those three important parts? See, this red one is called as the genu of the corpus callosum. Next, this entire part here which you can see, this entire part which you can see is called as a body or the trunk of the corpus callosum, and the last part over here is called as a splenium of the corpus callosum. Three important parts. One is called as the genu of the corpus callosum. Next we have got is the body or the trunk of the corpus callosum. Next we have got the last important part, that is the splenium of the corpus callosum. Okay. Now, if you see here, if you look at the genu of the corpus callosum, hanging down from the genu of the corpus callosum, you see a small blue color structure that is hanging down. This is called as a rostrum. What is this called? Rostrum. Okay. Beneath that rostrum, you see a black color thing here. This is called as your anterior commissure. Okay. Beneath that anterior commissure, you have got an elongated structure that is called as linea terminalis. Okay, and beneath the linea terminalis, you see this entire thing is called as a base of the brain. This entire thing is called as your base of the brain. So beneath this linea terminalis, you have got this particular structure called as optic chiasma. What is this structure? This is called as your optic chiasma. Right, guys? So this is the picture which you can see from So guys, this is a picture which you can see from the medial surface, right? Now on the medial surface, right, what do you mean by the medial surface? For example, if this is the cerebral hemisphere, this is called as a supralateral part of the cerebral hemisphere, and this is called as a medial surface of the cerebral hemisphere, right? Now in this medial surface of the cerebral hemisphere, these are the structures which you can see. Now what are the important structures which you can see over here? Now the first important structure is that you can see this elongated structure. This is called as your corpus callosum. Okay. Now into this corpus callosum, we have got three important parts. For example, let us say that this particular red color part which you can see over here, this is called as a genu of corpus callosum. Okay. Now after this genu of corpus callosum, this particular structure over here is called as the body or the trunk of corpus callosum. Body or the trunk of the corpus callosum. After that, the part which is on the back, the green color part, right? So this particular part over here is called as the splenium of corpus callosum. Three important things: genu of corpus callosum, body or trunk, and splenium of corpus callosum. Now in between that, you see a network here. Yes or no? I hope you can see a network in between like this. So this network is nothing but, you have to call this particular network as septum pellucidum. What is this? This is your septum pellucidum. So right now we are concentrating. So right now we will be discussing about the wall of the third ventricle. Okay, what are the walls of the third ventricle? Okay, now just down to the septum pellucidum, you see this blue color line over here. This blue color line is nothing but called as the fornix, right? So what is this blue color line here? This is nothing but called as the fornix. This is called as your fornix. Okay, now let us leave this discussion. Now just let us concentrate on the genu. Hanging down from the genu, you see a blue color part which is hanging down here. This blue color part over here is called as the rostrum. What do you call this? You call this as the rostrum. And beneath the rostrum, this particular part over here is called as anterior commissure. Now all these parts are very important because they form one of the wall of the third ventricle. Beneath that anterior commissure, structure which is hanging down is called as linea terminalis. What is this? This is called as linea terminalis. And below the linea terminalis, this particular structure which you can see over here is called as optic chiasma. Optic chiasma. This is called as your optic chiasma. After this optic chiasma, you see a V-shaped structure. This particular V-shaped structure you can see, right? This particular V-shaped structure is nothing but called as your tuber cinereum. What is this? This is called as tuber cinereum. Okay, this is your tuber cinereum. Now, hanging down from this tuber cinereum, you have got another important structure here. This is called as your medial eminence. What is this? This is called as your medial eminence. Now, once if you practice this picture, many number of questions will be solved. Okay, and all of you know this is your pituitary gland. Yes or no? This is your pituitary gland. Now behind this, posterior to this, you got another structure called as mammillary body. See, this particular structure is called as mammillary body. This particular structure is called as a mammillary body. And by the way, if you remember, this is called as your base of the brain, right? This is called as a base of the brain. Next, behind the mammillary body, you have got a substance which is perforated. This is called as a posterior perforated substance. Posterior perforated substance. Okay. Behind the posterior perforated substance, this is the pons, this is the medulla oblongata, and this is yellow, this one, the pink color highlight which I have given there is nothing but called as your midbrain. Okay, that is your midbrain. And in the center of your brainstem, you see a cavity here, right? What is this cavity actually called as? This is called as your cerebral aqueduct. This is called as your cerebral aqueduct. This is called as your cerebral aqueduct. Okay. Now let us go back over here. Now here, very important thing you need to understand here is that this particular gland which you can see over here is called as pineal gland. What is this? This is called as your pineal gland. Now pineal gland, what it is doing? This is called as pineal gland. And down here you see this black color structure over here. This is called as posterior commissure. This is called as your posterior commissure. Okay. Next, on the top also here you have got another commissure. What is this? This is called as habenular commissure. What is this? This is called as habenular commissure. Okay. One is posterior commissure and the other one is called as your habenular commissure. Now, if you look at the pineal gland, right, this pineal gland is having a stalk. This is called as pineal stalk, and this pineal stalk, it divides into two here, right? Now, in between both of them, you got a small recess like thing. This is called as pineal recess. This is called as your pineal recess, right? Now, whatever it is, you have got a cavity. This cavity is called as a cavity of your third ventricle. Now, this cavity of the third ventricle is divided into two parts with the help of this particular line which I am drawing over here. This particular line over here is nothing but called as your hypothalamic sulcus. What is this? This particular line over here is called as your hypothalamic sulcus. So hypothalamic sulcus is dividing the third ventricle into thalamus and hypothalamus. Okay, so this is your hypothalamic sulcus. Now if I ask you what are the borders of this third ventricle, what will you tell? If I ask you what is the roof made up of, okay, if I ask you what is the anterior wall of the third ventricle made up of, if I ask you what is the floor of the third ventricle made up of, and if I ask you what is the posterior wall of the third ventricle made up of, just look at the picture and answer. If I ask what is the roof of the third ventricle made up of, see, this entire thing which I am highlighting now, this entire thing is your third ventricle. Roof in the sense the top portion. The roof is made up of what? The roof is made up of this particular structure called as fornix. Okay, not only fornix, you even have got another structure called as choroid plexus. So roof is made up of fornix and choroid plexus. Choroid plexus. Done? Clear? Let us discuss about the floor now. The floor is made up of what? See, this entire thing is the floor. You will start your discussion from this particular part called as optic chiasm. You see, the floor is made up of optic chiasm. Floor is made up of tuber cinereum. Floor is made up of this medial eminence. You see, this is your medial eminence, right? Floor is made up of medial eminence. Floor is made up of tuber cinereum. Floor is also made up of, what is this? This particular structure is called as mammillary body, and floor is made up of posterior perforated substance. Just by looking at this picture, it is very easy to identify the floor. What are the structures? See, these are the structures. What are these from starting to ending? First is optic chiasm. Next is tuber cinereum. Hanging down to tuber cinereum, you have got medial eminence. Next you have got is the mammillary body. Next you have got is a posterior perforated substance. So all these form the floor. Okay, let us write it down. The structures which form the floor are, one is your optic chiasma. Next you have got is the tuber cinereum. Third one is called as the medial eminence, right? Fourth one is called as the mammillary body, Next important one is called as your posterior perforated substance, So these are the structures that are located over here. Okay. Now, what are the structures that are forming the anterior wall? What is anterior wall? See, this is your anterior wall. Now you tell me, what is the first important structure here that is forming the anterior wall? That is your rostrum. After that, what will be there? Anterior commissure. After that, what will be there? Linea terminalis. You see, this is rostrum, this is anterior commissure, and this structure is linea terminalis. Okay. So, which form the anterior wall are, one is your rostrum, okay, another one is your anterior commissure, another one is your linea terminalis, they form the anterior wall. Now let us look at the structures that form the posterior wall. What are the structures that form the posterior wall? Just look here. First is this particular structure called as habenular commissure. Okay. After habenular commissure, now you see this pineal gland. Now this pineal gland has got pineal stalk which is divided into two. Now this one is called as the anterior division. This is called as the superior division. This is called as the inferior division. Now the superior division, what has happened? It came anteriorly forward, posteriorly backward, again anteriorly forward, and attached to the habenular commissure. You see, how is the course? First it came anteriorly forward, then posteriorly backward, again anteriorly forward, and then attached to the habenular commissure. If you look at the inferior division, this directly attached to this particular structure called as posterior commissure. Now, wherever there is a gap, there is a recess that is formed. For example, here there is a recess that is formed called as pineal recess. Above the pineal recess should be supra or infra? Supra. So this pineal recess is called as suprapineal recess. Whatever it is, this black color structure is called as habenular commissure. This is called as suprapineal recess. This is called as pineal recess. And this is called as what? Posterior commissure. All these form the posterior wall. What wall? The posterior wall. Okay. Let us write it down. Just by looking at the picture, you can answer. Posterior wall is formed by habenular commissure, supra, what is this? Suprapineal recess. Next you have got is the pineal recess. Next you have got, what is that? Pineal gland also. And next you have got is a posterior commissure. So these are the structures that form the posterior wall of what? Of your third ventricle. Okay. Now let us discuss another important topic, that is your interpeduncular fossa. Right. Now what is your interpeduncular fossa? Now all of you know that this is your cerebral hemisphere and this part is your midbrain. Okay. Now this structure which I am showing it to you here, this is called as your base of the brain, and this is called as the anterior part of your midbrain. Front of your midbrain, below the base of the brain, you have got a fossa here. This fossa is called as your interpeduncular fossa. Okay. Now within this interpeduncular fossa, there is one interpeduncular fossa. Another important thing is that you should know what are cisterns. Cisterns are, for example, what is the outermost layer? Outermost layer is your dura mater. Okay. After that, what is the next layer you have got? Next layer you have got is the arachnoid mater. Now at some places like this. Now at some places you see the arachnoid mater has got some wider gaps. Beneath the arachnoid mater there is a gap, but at some places where this arachnoid mater is covering the structures, there are some wider gaps that are left. These wider gaps are nothing but called as cisterns. I will show them to you, but just write the definition. What are these cisterns? Cisterns are nothing but called as the wider gaps of subarachnoid space. Wider gaps of the subarachnoid space is nothing but called as your cisterns. Just look at this particular picture over here. Now here you can see that the outermost layer is what? What is your outermost layer? That is, see, that is your dura mater. Now, what is this red color layer over here? This red color layer is nothing but your pia mater. This is your arachnoid matter. There is no dura mater which I have drawn here. This is your arachnoid matter and this is your pia mater. Okay. Now, what I am telling you is that you see some empty spaces or wider gaps here. 1, 2, and here also you see some wider gaps. These wider gaps of the subarachnoid space is nothing but called as cisterns. For example, near the interpeduncular fossa region, you got a wider gap. This is called interpeduncular fossa or cistern. This is called as cistern. Interpeduncular cistern. Interpeduncular cistern. Second important thing is that in front of the pons, you have got a wider gap. This is called as cisterna pontis. Cisterna pontis. Next, here also you have got a wider gap. This is called as cerebello-medullary cistern. Cerebello-medullary cistern. Why it is called cerebello-medullary cistern? Because it is between the cerebellum and the medulla oblongata. Okay, right. Now let us discuss these structures, because these structures will later on come while discussing the borders of the interpeduncular fossa. So what is this particular structure which I have already discussed this? Tell me. This is your olfactory bulb. Olfactory bulb. Olfactory bulb continuation will be your olfactory tract. Olfactory tract. Okay. Next, this one is your optic nerve. What is this? This is your optic nerve. Both the optic nerves, they join together. This black point here is called as optic chiasma. What is this? This is called as optic chiasma. Okay. Just beneath that, what do you have? Tuber cinereum. What do you have? You have got is a tuber cinereum. Okay. You remember that base of the brain we discussed optic chiasma, tuber cinereum, posterior perforated substance, mammillary body. You remember that? So the same structures I am discussing it here. Okay. So next important thing is we have discussed the wall of the third ventricle, right? Now go to that page of the wall of the third ventricle, see the inferior wall one by one. First you have got optic chiasma, second you have got tuber cinereum, third you have got this particular structure called as mammillary body. This particular structure is called as your mammillary body. After that you got this one is called as a posterior perforated substance. This is called as posterior perforated substance. Behind that, what do you have? You have got one is called as this is the midbrain. So you have got as the right crus of the midbrain, and this one over here is called as the left crus of the midbrain. Right crus of the midbrain and left crus of the midbrain. And down here you have got the pons, and finally you have got the medulla oblongata. These are the structures. Now, all the way, you see the line which I have drawn over here, all the way from the optic chiasma down till the superior border of pons. This structure which you can see here is nothing but called as interpeduncular fossa. If I ask you, interpeduncular fossa all the way hangs down, it hangs down all the way from the optic chiasm down till the superior border of the pons, the upper border of the pons. You see here, interpeduncular fossa extends from the midpoint of the optic chiasm down till the midpoint of the upper border of the pons. Now, if I draw a structure like this, if I draw a structure in this way, connecting all of that, you see I have got 4 important borders. What are these 4 important borders? One is called anterolateral, 2 are called anterolateral, 2 are called as posterolateral borders. Now let us see what are these borders located here. Okay. Now, anteriorly what do I have? See, if this is the interpeduncular fossa, in the front what do I have anteriorly? I have got optic chiasma. Okay. Anteriorly I have got optic chiasma. Optic chiasma I have got anteriorly. Anterolaterally what do I have got? What do I have got anterolaterally? See, this is anteriorly. Anterolaterally in the sense, this one is anterolaterally. See, anterolaterally what do I have got? I have got these structures called as optic tracts. Optic tracts. Anterolaterally I have got what? I have got optic tracts. Optic tracks I have got anterolaterally. Posterolaterally, what do you have? Posterolaterally in the sense, see, these are posterolaterally. Posterolaterally, two important structures I have got. Right crus of the midbrain. This is called as the left crus cerebri of the midbrain. What are the two structures I have got? One is called as the right crus as well as the left crus cerebri of the midbrain. Right crus cerebri of the midbrain and the left crus cerebri of the midbrain. Posteriorly, what do I have got? Posteriorly in the sense this point. What is the posterior part? Exactly the midpoint of the upper border of pons. Posteriorly, I have got the midpoint of the upper border of the pons. So, these are the borders which you need to know. Coming to the floor of the interpedicular fossa, just remember it that floor of the interpedicular fossa is having tuber cinerem. Tuber cinerem, you know what is tuber cinerem. You also know what are mammillary bodies. Mammillary bodies. Okay, you also know what is posterior perforated substance. And by the way, why you need to just remember it? Perforated substance. These things, you remember that I have drawn in the form of a picture where I was explaining you the wall of the third ventricle, right? So there the structures which are located on the down inferior surface are tuber cinerem, mammillary bodies and posterior perforated substance. These structures we have discussed it. Coming to the contents of interpedicular fossa, only one thing, that is circle of Willis. Circle of Willis. Okay. Right guys, so now let us discuss few important points regarding the blood-brain barrier. Okay, few important points regarding this blood-brain barrier. Now when it comes to the blood-brain barrier, few important things which you need to know is that, for example, right, let us say this is your blood vessel. Okay, now within this blood vessel over here, you have got endothelial cells, right? So this is your capillary endothelium. So this is your capillary endothelium like this. Capillary endothelium. Now within this capillary, all these are endothelial cells with capillary endothelium. And next important thing which you need to know over here is that here we have got some cells like this. These are called as astrocyte cells. What are these cells? These cells are called as astrocyte cells. So these astrocytes are the one which form the blood-brain barrier. But if I ask you what is a true blood-brain barrier, that is the true blood-brain barrier is formed by the tight junctions of the capillary endothelium, right? So between the capillary endothelium, you have got tight junctions. Okay, between the capillary endothelium you have got tight junctions, and these tight junctions of capillary endothelium, they form the true blood-brain barrier. Okay, and by the way, this is the basement of your capillary endothelium, right? This is the basement of your capillary endothelium. Now if I ask you what are the areas that are not having the blood-brain barrier, yeah, what are the areas devoid of blood-brain barrier? Yes, what are the areas that are devoid of blood-brain barrier? Just remember the mnemonic HAPS no. Okay, so what do you mean by, repeat. Just remember the mnemonic no maps. Okay, no maps. Now what does N stand here? N stands for neurohypophysis. Neurohypophysis is not having any blood-brain barrier. O stands for OVLT. What do you mean by OVLT? Organum vascularum. OVLT. What is OVLT? Organum vasculosum of lamina terminalis. What is this? Organum vasculosum of lamina terminalis. Okay, this is called as your OVLT. And what is the third important thing? M. What does M stand for? M stands for medial eminence. M stands for medial eminence. Okay. Next, fourth important thing, A stands for what? Area postrema. Area postrema. Okay. Next, fifth important thing, MAP, what does P stand for? Pineal gland. Pineal gland. And what is the sixth important thing? MAPS. S stands for subtornical organ. And S stands for subfornical organ. Okay, subfornical organ. Okay, so these are the structures, right, that are devoid of your blood-brain barrier. Now, let us discuss about the important concepts of the spinal cord. So, the first important thing which you need to know is that the adult spinal cord as well as the spinal cord in the neonate. Okay, so in the spinal cord in the adult and spinal cord in the neonate. In the adult, the spinal cord starts all the way from C1 all the way till the lower border of L1. All the way till the lower border of L1. When it comes to the neonate, again here also it starts at C1 all the way till the upper border of L3. Upper border of L3. Okay, upper border of L3. Now, if you look at the spinal cord, the end portion of the spinal, let us say this is your spinal cord. The end portion of your spinal cord is nothing but called as conus medullaris. See, this end portion is called as your conus medullaris. This is the end portion of the spinal cord. Okay. Next important thing is that surrounding this end portion of the spinal cord, the layer which you have got over here is called as your pia mater. You see, this particular region over here is called as what? This is called as your pia mater. Okay. Surrounding pia mater, what do you have? You have got arachnoid matter. Let us say surrounding this, you have got arachnoid matter which would stop here. So this is the arachnoid matter which is stopping all over here. Right. Now, after that what? You have got the dura mater. So, surrounding that you have got what? Dura mater which is also stopping here. So, where is your subarachnoid space? This is the subarachnoid space containing your CSF. You see, this is the subarachnoid space containing your CSF. Now, if I ask you where is the spinal cord terminating? This is the place, that is the L1 border. Okay. Now, if I ask you where the arachnoid matter and the dura mater, the outer dura mater and the middle arachnoid matter are meeting, see here, this is the arachnoid and dura mater together. They are meeting at which point? These both of them are meeting at the level of S2. Okay, so this is the level of S2 where both the arachnoid matter as well as the pia mater are meeting. And down here, there is extension of pia mater. Only pia mater is getting extended down. So, this particular extension of pia mater, is nothing but called as your filum terminale. This extension of pia mater is nothing but called as your filum terminale. If you wanted to do a lumbar puncture, which point you will select? You will select between L1 as well as S2. So, this is the place where you do the lumbar puncture. Okay. Now, next important thing is that when you make a section of the spinal cord, right, if you look at the spinal cord in this way, if you make a section of the spinal cord, if this is one of the section of spinal cord, this section of the spinal cord is divided like this into many laminae. Okay, so around spinal cord is divided into 10 laminae. Actually, the horns of the spinal cord. If I divide the spinal cord like this, right? So this is the dorsal side of the spinal cord. This is the ventral part of the spinal cord. Right. So these horns of the spinal cord are divided into 10 laminae. We are also calling this as rexed laminae. So the horns are divided into 10 laminae. These laminae are called as rexed laminae. How many are these rexed laminae? 10. There are 10 rexed laminae. 1 to 10 rexed laminae. Okay. So each laminae corresponds to a specific nuclei. So what I am telling you that these laminae, they correspond to a specific nuclei. For example, laminae 1 will correspond to a specific nuclei. Let us say laminae 2 will correspond to a specific nuclei called as substantia gelatinosa. So in the same way, each laminae will correspond to a specific nuclei. So let me first write down those and later on I will show it to you in the form of a picture. Okay. So let us say we have got laminae, let us say we have got laminae 2, okay, we have got laminae 3 to 4, we have got laminae 5 to 6, we have got laminae 7, right, and we have got laminae 8. So these are the laminae. Now laminae 2 will correspond to a nucleus called substantia gelatinosa. Substantia gelatinosa. Lamina 3 to 4 will correspond to a nucleus called as nucleus proprius. Nucleus proprius. Lamina 5 to 6 will correspond to a nucleus called as posterior thoracic nucleus. Posterior thoracic nucleus. In the same way, lamina 7 will correspond to a nucleus called as intermediolateral nucleus. Intermediolateral nucleus, and finally lamina 8 will correspond to sacral parasympathetic nuclei. Sacral parasympathetic nuclei, right? Now just look at this lamina over here. So this is the section, right? See how many laminae are there? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 laminae are there. The same 10 laminae are representing, they are accompanied or these corresponding to the specific nuclei. So the first nucleus over here which you can see is called as substantia gelatinosa. So substantia gelatinosa is what? This is 2. 2 corresponds to substantia gelatinosa. Next nucleus is called as nucleus proprius. Nucleus proprius. Okay, after nucleus proprius we have got posterior thoracic nucleus, right? So this nucleus over here is your posterior thoracic nucleus. After posterior thoracic nucleus we have got intermediolateral nucleus. Intermediate lateral nucleus. Where is this? This is the green one. Okay, this is your intermediolateral nucleus. Intermediolateral nucleus. And finally the last one, the sacral parasympathetic nucleus, is not shown here, but these two are not other nuclei. I mean, these are just motor neurons. Okay, this is not the important part. You know, from the ventral region, the motor neurons will come up. Now let us discuss about the sensory pathway. I mean, the ascending as well as the descending pathways, right? So basically, what are the different kinds of tracts we have got in the spinal cord? We have got two different types of tracts. What are these two different types of tracts? One tracks are sensory or ascending pathways. Another one is motor or descending pathways. Sensory or ascending, motor or descending pathways. Now when it comes to sensory or ascending pathways, here we have got four important types of tracts. The first one is dorsal column, medial lemniscus pathway. Dorsal column medial lemniscus pathway. Okay, so this dorsal column medial lemniscus pathway is in turn divided into two. It is called as 1A, 1B. What is 1A? 1A is cuneate fasciculus. Cuneate fasciculus. 1B is fasciculus gracilis. Fasciculus gracilis. It means one is taking the sensations from the gracilis, that is the lower limbs. Another one is taking the sensations from the upper limb. Coming to the second important tract. What is this? Spinocerebellar tract. That is your spinocerebellar tract. Okay, spinocerebellar tract is again two. One is called as 2A, another one is called as 2B. 2A is what? Posterior spinocerebellar tract. Posterior spinocerebellar tract. Okay, and the other one is ventral spinocerebellar tract. Ventral spinocerebellar tract. Okay, we shall look at the localization of these tracts in a minute. Third important thing. What is the third important thing? That is anterolateral spinothalamic tract, or simply spinothalamic tract. Anterolateral spinothalamic tract. So within this anterolateral spinothalamic tract, there are two important things. One is called as 3A, another one is called as 3B. What is 3A and 3B? In anterolateral. Anterolateral in the sense anterior and lateral. So, anterior spinothalamic tract, STT. Another one is lateral STT, lateral spinothalamic tract. Two important tracts. And the fourth important thing here is spino-olivary tract. That is your spino-olivary tract. Spino-olivary tract. Right? Now let us look at the pictures over here. Now here it will be completely clear for you to understand what are these tracts. You see, here we have got 1A and 1B. What are 1A as well as 1B? 1A and 1B are, 1A is cuneate, right? So this is the thing which we discussed, right? So this is your cuneate fasciculus, and this one over here is your fasciculus gracilis. Fasciculus gracilis. Okay. Next important one is 2A and 2B. So 2A and 2B is, one is posterior spinocerebellar ventral. See, this one is your posterior spinocerebellar. Why are you calling it as posterior? Because if I divide the spinal cord, this is the posterior part, this is the ventral part. Ventral or anterior, posterior or dorsal. You can call this as dorsal spinocerebellar tract or posterior spinocerebellar tract. And this one is called as anterior spinocerebellar tract or ventral spinocerebellar tract. In the same way, we have got 3A and 3B. Now, out of this 3A and 3B, 3A is located laterally, 3B is located anteriorly. So, anterior spinothalamic tract, 3A is lateral spinothalamic tract. Okay. And finally, this fourth one which you see, this is your olivary tract. Okay. Olivary tract which is going from spinal cord. So, spino-olivary tract. So, all these tracts which I have discussed just now are sensory tracts which are taking the information to the cortex, right? Now, let me discuss about the motor tracts. Now, let me discuss about the motor tracts. Now, when it comes to motor tracts are also called as a descending pathway. Descending pathway. Now, these motor tracts or descending pathways, they are of basically two important types. What are these two important types? One is called as pyramidal tracts. Pyramidal tracts. Another one is called as the extrapyramidal tracts. Extrapyramidal tracts. Pyramidal and extrapyramidal. So, what do you mean by pyramidal tracts? Pyramidal tracts are your 5A and 5B. Okay. There is lateral corticospinal tract, which is a pyramidal tract. Another one is anterior corticospinal tract. Okay. When it comes to extrapyramidal tract, there are four different types of extrapyramidal tract. What are these four? 6A, 6B, 6C and 6D. This is just a representation. Okay. What is 6A? That is reticulospinal tract. Reticulospinal tract. Okay. What is 6B? Rubrospinal tract, which I have already discussed, which starts from the red nucleus in the midbrain. Next, from the vestibular nucleus, the vestibulospinal tract, and finally we have got the olivospinal tract. Olivospinal tract. Okay. So let us look where these tracts are present. 5A. Where is your 5A over here? See, this is your 5A. Right. So 5A over here comes what? This is lateral corticospinal tract. Right. After that, this is 5B. 5B is anterior. So, anterior corticospinal tract. 6A, right? 6A is reticulospinal, 6B is rubrospinal, 6C and 6D, this is vestibulospinal, and this is your olivospinal. Okay, so this is the important thing which you need to know. Let us look at one of the most important reflexes in your body. Okay, coming to this most important reflexes, what do you need to know here? Biceps reflex is done for which muscle? To check which muscle? That is your biceps. Brachioradialis reflex is done for brachioradialis muscle. Brachioradialis muscle. Triceps reflex is done by triceps muscle. Triceps muscle. Knee reflex. You do knee reflex to check which muscle? That is your quadriceps muscle. Quadriceps muscle. Ankle reflex you check for what? Gastrocnemius muscle. Gastrocnemius muscle. And cremastric reflex you check for cremaster muscle, and anal wink reflex you check for external anal sphincter. External anal sphincter. Let us look at their spinal levels. Okay. So if biceps is working, it means the spinal level C5, C6 is working well. The same with the brachioradial is C5, C6. Triceps, what? C7 and C8. Quadriceps is L3 and L4. Gastrocnemius is S1 and S2. Cremastric is L1 and L2. External anal is S3 to S5. These are the things which you need to know. Okay. Right. Coming on to the next important thing. So this particular question has been asked every year, guys. So very important thing. What is this important thing which you need to know? You have to identify what are the structures that are located here. Okay. So first important thing I want to tell you is that there is outer gray matter over here. There is outer gray matter over here, and this is your white matter, which is white in color. Okay. Now, next important thing is that here you have to identify the nuclei, which is very important. See, let me write down the numbers. The first number which I am writing over here, the first number is your thalamus. What is this? This is your thalamus. Just side to the thalamus, number 2, whatever I am writing over here, right? This is called as your lentiform nucleus. What is this? This is called as your lentiform nucleus. Next, number 3, whatever I am writing over here, this is called as your caudate nucleus. What is this? This is called as your caudate nucleus. So 3 important nuclei are covered. One is thalamus, another one is lentiform, another one is your caudate nucleus. Okay. Next important thing is that you have to know where is the anterior horn of lateral ventricle and posterior horn of lateral ventricle. So these structures here, they comprise, see, this particular structure here comprises the anterior horn of lateral ventricle, and this structure over here is the lateral horn of lateral ventricle. Lateral horn of lateral ventricle, anterior horn as well as the lateral horn of the lateral ventricle. Okay. So these are some of the very important structures which you need to know. Let us look at those structures here now. So what did I tell you? You have got the gray matter and center is white matter. These two structures we have discussed. We discussed there is thalamus in the center. Side to it we discussed lentiform nucleus. We even have discussed caudate nucleus here. Anterior horn of lateral ventricle, posterior horn of lateral ventricle. And the structure which is hanging down in the center here, this is not the pituitary gland. This structure which is hanging down in the center is called as your fornix. What is this called? This particular structure is called as your fornix. Okay. So guys, now let us discuss the structure and the function of a neuron, right? The structure of a neuron and its types. So you know that there are 3 different types of neurons based upon the structure and its types. Okay. One is called as neuronal tissue proper, specialized connective tissue, and ordinary connective tissue. When it comes to neuronal tissue proper, you have to know about the neurons and the nerve cells. When it comes to the specialized connective tissue, glial cells are considered as a specialized connective tissue. When it comes to the ordinary connective tissue, that tissue that is present in the meninges, right? Like dura mater, arachnoid matter, and pia mater, they constitute the ordinary connective tissue. Coming to the structure of a neuron. When it comes to the neuron, you can see that this is called as a cell body or perikaryon. Okay. Surrounding that, what is there? There is nissl substance. Nissl substance is having what? Rough endoplasmic reticulum. Next you have got is a nucleus, and this part from where the axon starts is called as axon hillock. And remember one thing, it is from the axon hillock the action potentials are generated. Very important. Okay. From where are these action potentials generated? Action potentials are usually generated from the axon hillock. And down here you have got your axon. Now here organelles. What are the different kinds of organelles you have got? One is nissl substance and neuronal filaments. These are the 2 important organelles that are located within the cell body. And the remaining things are, you know, axon terminal and terminal buttons. Now coming to the glial cells, there are 2 different types of glial cells. Glial cells are specialized nervous tissue, right? One is called as central glial cells, another one is called as peripheral glial cells. Central glial cells are what? Central glial cells are oligodendrocytes, astrocytes, microglial cells and ependymal cells. These are all the central glial cells. Coming to the peripheral glial cells, Schwann cells and satellite cells are called as peripheral glial cells. Okay. Now, if you look, the neurons in the central nervous system are myelinated with the help of oligodendrocytes, whereas the neurons out of the central nervous system are myelinated with the help of Schwann cells. So, who is forming the myelin sheath of the neurons of central nervous system? Oligodendrocytes. Now, who is forming the myelin sheath of the neurons of peripheral nervous system? That is your Schwann cells. Next important thing is regarding the type of neurons. What are the different type of neurons? First important thing is that based upon number of poles, we divide the neurons into different types. First important example is your multipolar neurons. Why are you calling it as multipolar neurons is that if this is a cell body in the center, let us say this is a cell body. From this cell body, how many structures are coming out? See, one structure is coming down, you call it as axon. One structure is going up like this, these are called as dendrites. So from a single cell body, many outlet points are there. That's why called as multipolar neurons. It is having multiple poles. Where do you see this? Cerebral cortex, cerebellar cortex, anterior or ventral horn of the spinal cord. Okay. Now, in the same way, if you look at the second important type, that is called as a bipolar neuron. Why are you calling it as a bipolar neuron? Because you can see two poles. Only from these two poles only the structures will come out. One is called as axon, one is called as dendrite. Bipolar neuron. Now the examples are, one is called as your olfactory neuron, another one is called as your retina of the eyeball. Okay. Now coming to the unipolar neuron, which is also called as a pseudo unipolar neuron. What do you mean by unipolar neuron? Only from a single pole only the structures are coming. Now this looks like a unipolar, but actually later on it divided into two, one peripheral process, one central process. That is why you called it as a pseudo unipolar neuron. Okay. So this is the thing, this is how the pseudo unipolar neuron is formed. Initially it is having two poles, right? Later on what happened? These two poles, they joined each other in this particular manner, right? Leading to the formation of a single pole. Okay. Now pseudo unipolar neurons are what? Your spinal ganglion is having a pseudo unipolar neuron. Your sensory ganglion of 5th, 7th, 9th and 10th cranial nerves are again sensory. These sensory ganglions are again the pseudo unipolar neurons. Next is anaxonic neurons, where there is no axon at all. Only dendrites are present. These are the amacrine cells of your retina. In the same way, apolar neurons, in the sense they don't have any poles, just the cell body. Where are they present? They are present in the adrenal medulla. So these are some of the very important things which you need to know regarding these neurons. Now based upon the function of neuron, there are four important functions. One is called as a sensory neuron, motor neuron, interneurons and autonomic neurons. What do you mean by sensory neuron? Sensory neuron carries the sensory information, which you know that. Motor neurons, they carry the motor information. Sensory is always on the dorsal side, motor is always on the ventral side. Okay. What is the interneuron? Interneuron is something that is present in between the sensory and motor, is called as interneuron. And autonomic neurons, you know, where you have got sympathetic and parasympathetic actions. Based upon the length of the axon, there are two different types. Golgi type 1 neurons, Golgi type 2 neurons. Golgi type 1 neurons are the long axons, Golgi type 2 neurons have got a short axons. Okay. Now, very important thing is that, do neurons regenerate? Do neurons regenerate? No. Why? Because they do not have centrioles. Centrioles are the one which are responsible for cell division. Except olfactory nerve, it has centrioles, and that is the reason why olfactory nerve can regenerate, but remaining cannot regenerate. Okay. Now coming to the very important topic, that is the Brodmann areas of cerebral cortex. So cerebral cortex is divided into two. One is called as neocortex, another one is called as allocortex. 90% is the neocortex and only 10% is your allocortex. Why? Neocortex is having how many layers? 9 layers. Whereas allocortex is having how many layers? 3 to 5 layers. Okay. Right. Now, if you look, each lobe we will discuss now. First of all, if you look the Brodmann areas of the frontal lobe, right? The most important lobes are the frontal lobe. If you look at the Brodmann area of the frontal lobe, you can see here, this particular one is called as a central sulcus. In front of the central sulcus, this area which you see is called as a precentral area. This precentral area, okay. After that, in front of that, you have got the precentral sulcus, okay. In front of the precentral sulcus, you also have got another area, okay. Now, just look here. You have got another area. So overall, this precentral area is divided into two areas. One is called as the motor, another one is called as a premotor. Motor area or the precentral gyrus is your area number 4 and premotor area is your area number 6 and 8. Okay, area number 6 and 8. Now, let us look at this important thing, that this is a supralateral surface. Here I have got area number 4. Here I have got area number 6 and 8. Now, when this area number 4, area number 6 and 8, they come medially towards me, right? When they come medially, how does the picture look? This is how the picture look. So, this is area number 4 and this is area number 6 and 8 which is located medially, okay? Now, if you look at this is what I told you. Broadman areas of the frontal lobe are divided into two areas. One is precentral, another one is prefrontal. Precentral is divided into two. One is called as the motor area, which is called area number 4. Another one is a premotor area called as area number 6, 8. Now I am also telling you another area, that is 44 and 45 are also premotor areas. So 6 and 8, right? So if you look at the arrangement of the homunculus in area number 4. So what is this arrangement is that the lower part is for the larynx, next pharynx, next T for tongue. Here we have got the face, the upper leg, trunk, thigh, knee, leg, foot, and these two structures over here constitute the perineum, where two actions, one is it controls the anal sphincter and the urethral sphincter. Very, very, very important. Okay. So you need to see here that there are two different types of movements in your body. One is called as your fine movements, another one is called as your coarse movements, right? So the actions of the fine movements, wherever the fine movements are there, for them larger areas have been given. For coarse movements, smaller areas have been given. For example, fingertip movements, tongue and lip movements, mouth movements, all these are the fine movements. For that, the larger centers have been given. Coarse movements in the sense flexion, extension, abduction, for that smaller centers have been given. Okay, smaller centers have been given for that. So this is what you need to know. So this is all about your area 4. Okay, so what is area 4 once again? Area 4 is the motor area, okay, or you can also call it as a precentral area. So the precentral gyrus is nothing but having your area number 4, okay. Now, next important thing, I already told you that when I was discussing the sulcus, lateral sulcus and all, so this one is your lateral sulcus. Right, lateral sulcus is having three important parts. This is called as a posterior ramus. These two are called as the anterior ramus. Within the anterior ramus, again two ascending anterior ramus and horizontal ramus. Right? Now here you have got three important areas I told you. What are those three? Pars orbitalis. Next you have got pars triangularis. Next you have got pars opercularis. All these three over here constituting two important parts. Area number 44, area number 45. Area number 44 and 45 are called as your Broca's area. So, area number 44 and 45. Exactly speaking, 44 is where? 44 is pars triangularis and pars opercularis is your 45. Okay? Right. Now, coming to area number 6 and 8. Area number 6 and 8. Now, if you look at the functions of area number 6 and 8, what are the functions you see? So, first is coordination of voluntary movements. What is the second action? It is associated with the function of the extrapyramidal system. Now, basically, you need to understand that motor system is divided into two parts. One is called as a pyramidal system and the other one is called as the extrapyramidal system. For examples, if you are making any kind of voluntary movements that come under the pyramidal system. Okay? And what does extrapyramidal system do? That will modify the pyramidal system. For example, let us say this is the location of my house and this is the bus stand, right? So even let us say the bus comes there at 9:30 in the morning. Even if I start by 9:25, I can very easily reach the bus stand. Let us say the house is here and the bus stand is here, right? Now if I start 5 minutes before, will I be able to reach? No. This time what will happen? Now I have to increase my voluntary movements. It means I have to increase my pyramidal system. Who is increasing my pyramidal system? The extra pyramidal system will stimulate the pyramidal system, and thus I will have an increased voluntary movements, right? So that is the important thing which you need to know, and that is carried out by what? Area number 6 and 8. So that is your area number 6 and 8. Where is this area number 6 and 8 is located? It is located posterior to the superior frontal gyrus. So this is superior frontal gyrus, middle frontal gyrus and inferior frontal gyrus. So posterior to the superior frontal gyrus, you have got your area number 6 and 8. Next, down to that, I mean the posterior part of the middle frontal gyrus, this area which I have written in the form of a boxes, this is called as a frontal eyelid, right? This is called as a frontal eye field. What is this field called as? Frontal eye field. Where is this located? This is the posterior part of the middle frontal gyrus. So even this also has got 6 and 8. Right? Now what is this posterior end of the middle frontal gyrus responsible for? Eye movements. Two eye movements, one is convergence, another one is conjugate deviation of the eyes. Convergence is this one, conjugate deviation is at a time you are looking laterally, or you are looking to the left, or you are looking to the right. This is called as conjugate deviation of your eyes. Okay, so for example, if I am looking to the right, it means the lateral rectus of my right eyeball is contracting and medial rectus of my left eyeball is contracting, and thus I can look to the right. So this is called as conjugate deviation of the eyes. So this is done by what? Again, area 6 and 8, which is located behind the middle frontal gyrus. Right. The next important thing is, in the frontal region, you have got this particular area that is called as a prefrontal area. What is your prefrontal area? Area number 23, 24 and 31 is called as your prefrontal area, right? So area number 23, 24 and 31. So this is area number 23, 24 and 31. Now if you are going on to the opposite side, which means the medial side, on the medial side it is 23, 24 and 31. Okay, the same things. Okay, now what is this area, prefrontal area, is responsible for? It controls the emotions, mental concentration, attention and behavior. So these are the 4 important things which you need to know.